Welcome to the October 2025 educational event. I'm Kavya Velagapudi, Executive Director of the Neuroendocrine Cancer Foundation.
I'm Lisa Yen, Director of Programs and Outreach.
And I'm Heather Davis, the Director of Community Engagement.
Today's presentation is on coping with neuroendocrine cancer, managing distress, worry, and grief. A special thank you to our supporters, Novartis, Ipsen, Exelixis, Tercera, Curium, Cronetics, ITM, Boehringer Ingelheim, and InterScience Institute. Neuroendocrine Cancer Foundation, previously known as LACNETS, provides a community of support and education for neuroendocrine cancer patients and caregivers. Our staff includes Lisa Yen and Heather Davis. Our board includes Donna Gavin, who is the sister of our founder, Giovanna Joyce Mbezi, and net patient Mary Dunleavy. Neuroendocrine Cancer Foundation partners with the Carcinoid Cancer Foundation to provide its programs, including the Luncheon with the Experts and support line. Now I'll hand it over to Heather.
Thank you, Kavya. Our YouTube channel features over 475 educational and wellness videos, testimonials, and podcasts. Click videos or playlists to find patient and caregiver stories, guided meditations, yoga, as well as treatment information from neuroendocrine cancer experts. And you can also find our educational videos by topic on our website's video library under the Resource tab. Find us on social media, Facebook, X, and Instagram with our handle at NCF Cancer. And be sure to add us to your Safe Sender email list. I'd like to remind the audience that our webinars are created for educational purposes only and do not substitute for medical advice. The views shared in this webinar are from the experts' experiences and insights. Please contact your medical team with questions or concerns about your individual care or treatment. And now I'll hand it over to Lisa.
Thank you, Heather. Dr. Karen Kirsting is a licensed clinical psychologist who provides counseling and psychotherapy to patients treated by surgeons in the Division of Surgical Oncology at the Medical College of Wisconsin. She completed her undergraduate degree in journalism at the University of Wisconsin-Madison, earned her PhD in counseling psychology from Virginia Commonwealth University in Richmond, Virginia, and completed a postdoctoral fellowship in clinical health psychology at the Dayton Veterans Administration Medical Center in Ohio. She joined the Medical College of Wisconsin faculty in 2016. Dr. Kirsting's research focuses on developing and evaluating integrated psychosocial services for people coping with cancer diagnosis and treatment. I first learned about Dr. Kirsting through neuroendocrine cancer surgeon Dr. Kalisa Clark, Chief of Surgical Oncology at the Medical College of Wisconsin, who is also one of our medical advisors. During one of our conversations, Dr. Clark happened to mention that every single one of her neuroendocrine cancer patients also meets with a licensed psychologist at their very first visit. I was amazed. It sounded too good to be true. I then had the pleasure of hearing Dr. Kirsting speak at the 2022 NANET Symposium on Mental Health in Neuroendocrine Tumors, a talk intended for medical professionals. And I found her message so powerful and relevant for patients that I immediately invited her to join us for a podcast episode. That episode, Mental Health and NETs, remains one of our most popular and widely listened to episodes. A neuroendocrine cancer diagnosis can bring emotional, mental, and psychological challenges that are just as difficult as physical ones. We understand, and that's why we invited Dr. Kirsting here today to talk about coping with neuroendocrine cancer, managing distress, worry, and grief. Welcome, Dr. Kirsting.
Hi there. I'm Karen Kirsting, and I am a psychologist with the Medical College of Wisconsin. I'm part of the Department of Surgery, and specifically the Division of Surgical Oncology. Thanks very much for having me. So I want to start today with a little story. This is my street. I really love my street and the way the trees connect over the street. And we moved here in 2019. And one of the things I was most excited about was the fall, how beautiful autumn would be on my street. I expected it to look like this. This is what I was planning on. And this is what I got that year. It happened to snow in October before the leaves had turned colors, and the green leaves fell on top of the white snow. And this is not at all what I expected. So why do I start with this story? I think it's really important at the top when we're talking about cancer and we're talking about our reactions to it to start with, none of this is what you expected. Cancer is not what you planned for, not what you expected for your life. It shows up and it throws a wrench in everything. You can be completely planning to do some wonderful raking and get stuck with a snow shovel that you didn't want at all. So my goal for this talk today is to discuss some of the common emotional and social challenges faced by neuroendocrine tumor patients. We'll talk about strategies for coping with specific behavioral problems, strategies for navigating family and other social relationships, and some broad thoughts about coping with life-changing illness. A little about me. I have a PhD in counseling psychology with an emphasis in health psych. I am fellowship trained in health psychology specifically, and I've worked in surgical oncology now for more than 6 years. So let's start by talking about some of the challenges patients with cancer face, and none of these are going to be a surprise to most of you. Certainly, there's pain and discomfort related to treatment. There's worry about advancing disease and mortality. There's fatigue related to treatment and recovery from surgery. Low mood related to fatigue, low mood related to prognosis and worry and even depression, family issues, including communication about disease and need for caregiving, financial issues, and then just the stress of interacting with the healthcare system. And then specifically, some challenges unique to pancreatic NET patients, as well as many of the other types of NET cancer. There's often long delays in diagnosis and sometimes a history of misdiagnosis, frustration, confusion. There can be an uncertain trajectory of a rare disease. There can be lack of information about a rare condition. The difficulty of explaining this type of condition to others when it is so unusual, maybe very little information about it, even the fact that it is surprisingly treatable, perhaps compared to other types of pancreatic cancer, can be really difficult and stressful to explain. And then there can also be a lack of urgency in accessing supportive services like mental health support, social work. So many hard things related to having a cancer diagnosis. There's the shock of the diagnosis, anxiety related to prognosis, getting ready for surgery and coping with treatment, thinking, trying to imagine a life after treatment, fear of recurrence, and then dealing with families and caregivers too. So there's an impact here. Pancreatic neuroendocrine tumor patients tend to have lower scores on measures of health-related quality of life, higher scores on measures of depression and anxiety, and scores are even worse in patients with frequent incidents of diarrhea and flushing. Rates of psychiatric illness in all NET patients. There was a study where they matched NET patients to colon cancer controls, 5 years of cumulative data. Of all the NET patients, there was severe psychiatric illness in 7.7%, other psychiatric illness, so this would be more like depression and anxiety diagnoses, in 32.9%. And generally, there was no major statistical difference between NET patients and the controls. But there is a statistical difference in subtypes. Among those with small bowel and lung NETs, there is a little bit higher rate of psychiatric illness. And then in particular with serotonin producing NETs, there can be, again, a higher rate than in the control group. So what I'll talk today about is the patients I've worked with and what I've learned about many of the experiences that they have. But I think it's always important when I talk like this to make the point that every person's experience is different and there's no normal in the process of coping with cancer. There's just patterns that I see. So let's talk first about adjustment right after diagnosis. This is essentially an initial crisis. There is probably trauma related to a long wait for diagnosis, possibly some misdiagnosis. There can be difficult communication with family and coworkers, and it can feel like everything is falling apart. And so when people are having a first experience with crisis, this might, not be something they'd ever run into in their lifetime. For me personally, as a therapist, it's a unique opportunity to help teach about anxiety, to normalize some of the distress people are experiencing, and offer some skills that maybe haven't been needed in people's lives before. But, these first experiences of crises can make patients feel like they're going crazy. They're maybe not sleeping. They're feeling panic. Their bodies are not their own in some ways. And it's a very, very difficult period for many people. There's also a lot of difficulty in the diagnostic process itself. People may be dealing with anger towards the healthcare system, anger towards themselves potentially for not pushing sooner to get a diagnosis, maybe some self-blame. There can be despair about what could have been, and there can be a lot of anxiety related to healthcare system interactions, especially if some of those have been disappointing. So what is anxiety? I know y'all have heard of it and have a sense of what it is, but I like to kind of go over it when I'm talking about mental health with cancer patients so we can kind of conceptualize it like for the specific population. So worry and anxiety are useful cognitive processes that keep us safe and keep us on track in our lives. Anxiety is very useful when it gets us to pay the rent on time. But when worry is excessive or unproductive or feels out of control, it's not as helpful. And that's when people get into an area where they may be having something that could be considered an anxiety disorder, where the anxiety feels like it won't stop and it's not actually helping you reach any of your goals. At this point, our anxiety tends to tap into a fight or flight response, so we feel it not only emotionally, but also physically. So here's my friend, the squirrel. So think about a squirrel getting ready for winter. Its life is actually under threat in a sense. If it doesn't collect enough food to survive the winter, it's not going to make it. So its little brain is designed to think, got to find some nuts, got to collect nuts, got to collect nuts, got to get ready to deal with winter. And its brain has developed over time that get a little kick of dopamine every time that squirrel goes and finds the nut. Also get a little kick of dopamine every time the squirrel worries about the nuts. When you think about how this applies to cancer patients also feel as if they are under threat. They've received a life-threatening diagnosis. So your brain goes into squirrel mode. You start thinking all the time about all the things that could go wrong, all the things you need to do to try to stick around. And our brains could kind of get in this cycle of not only rewarding us for doing things that help us take care of ourselves, but also you get a little kick of dopamine every time you run the worry cycle itself when you're under threat. And so it can feel like that worry cycle is taking over your brain and you don't have control over it. This is especially hard because a lot of times with cancer, there's no nut. There's nothing to do about it. All there is the worry, and there's no immediate action to take. So there's also worry about the people around you. How will this impact my family? Very specifically, how will it impact children in the family? How will this impact my workplace and my livelihood? How do I feel about people knowing I have cancer, and who will take care of me? Lots of really stressful questions come up around cancer diagnosis. There's also lots of people that will want to show up for cancer patients. People keep asking how I am is something that I hear from patients all the time. And that itself can also cause a lot of anxiety. I like to call this the lasagna problem. The issue is everybody keeps showing up with frozen lasagna, and eventually your freezer is full with food that you might not have asked for. Maybe you love lasagna, that's great, but it also could be not quite what you need. So if you don't like people asking all the time how you are, or the people around you aren't helping in ways that are actually useful to you, it's useful to kind of change the subject, ask them to talk about something else. The funny thing about cancer is people around you often end up saying the wrong thing because they're nervous and they want to say the right thing. So they keep getting it wrong. I think eventually I'm going to end up writing a book called What Not to Say to Cancer Patients, because it's amazing the different ways people around cancer patients get it wrong. But the upside of that is If you tell the people around you what would be helpful to you or what you do want to talk about, or to tell them even specifically, please stop asking how I am, they actually will feel a reduction in their own anxiety, just knowing what to do. So even though we don't do this in our normal lives, tell people how to approach us or how to talk to us, it's very helpful in this specific instance for both getting the cancer patient what they need in terms of support, as well as easing the fears of the person who is trying to be helpful, because they'll know better what to do. It's a skill in of itself to learn how to ask for support and to feel comfortable doing so. I often, when I work with patients, we'll role play asking other people for help or asking them to approach them in a certain way. It's something that is not obvious and not easy, and it's worth it to practice it at times. So, among the things that are going to be in my book about what not to say to cancer patients is, you're so strong, right? That's a pretty common thing for people to say. And what the heck does strong mean? Okay, this guy is strong. We can argue that this guy is strong. We can argue that this bridge is strong, and none of this is particularly helpful to cancer patients, where strong might look like this. Or it might be a word that doesn't really feel comfortable at all. So, what do I mean when I say strong or when I try to help patients cope better? And that's what I'm going to kind of move into talking about now. Strong is really what you decide it is. And I think strong for people going through cancer is being in a place where they know what they're feeling and they're able to make decisions about how they want to feel and how they want to behave without being derailed by emotions. When they're able to have what they need, the support that they need, so that they can make good decisions about their health. So one of the topics I often talk with people about is, how do you prepare for difficult situations? In particular, when I'm working with pancreatic cancer NETs patients, they are often facing possibly a Whipple surgery, a big surgery that has a long recovery period. It's a long recovery in the hospital. And then when people get home from the hospital, it's again a long recovery in terms of fatigue. It can take 3, 4, 5, 6 months to kind of get out of that initial feeling of fatigue. So when I try to meet with patients ahead of this surgery and work with them around questions like, how will you handle several months of fatigue? Fatigue's really tricky. It's actually a symptom of depression, but on some level, it's kind of hard to figure out which comes first, the fatigue or the depression. If you're tired for 6 months straight, it's really hard to keep your mood up. So we also talk about how will you handle health setbacks. And we talk about kind of cultivating an attitude of resilience for a long period of time. It's not just coping with stress and coping with disappointment for a couple days. It can be dealing with that for months and months at a time. We'll also talk about how will it be to spend much more time than usual with your family and with your caregivers. That can cause interpersonal stress for a lot of people. And so that's another important thing to be open and honest about and think about your communication on. So why is this duck here? Another issue is, how do you deal with boredom when you're tired for 6 months? You're not able to go do the things that normally would be, life affirming for you, would be exciting and meaningful, because you may not have that energy. So I like to call this the wooden duck problem. We think about old guys in their 80s whose bodies maybe aren't cooperating with them in the way they used to. They end up picking up a hobby like painting wooden ducks, something that they can feel passionate about, that can be very meaningful to them, and that they can do while sitting comfortably at a table. So all of us at some point in our life need our own version of a wooden duck hobby. And it can be really important to find something like that during recovery from surgery, when fatigue is likely to be a factor for multiple months. Again, talking about adjustment after surgery, there can be challenges with sleep, challenges with eating, and again, fatigue and this relationship to depression. So I'm going to talk through some of these points. So sleep. Many patients actually have ongoing problems with sleep after a hospitalization. The hospitalization itself interferes with sleep. You've been woken up every couple hours for over a week, and that kind of can mess with your sleep pattern. There's also pain and discomfort associated with the treatment itself that can interfere with sleeping well. You might have anxiety that's preventing you from sleeping comfortably. There may be a lack of daytime activity for good reason. You're really tired, but not doing things during the day can also mess with your sleep schedule and kind of get that off track. Even fatigue itself, feeling tired all the time, can kind of interfere with your body's ability to know when it's time to actually close your eyes and go to sleep versus time to be awake but restful. So, any persistent sleep problems that develop after or during cancer treatment are best treated with something called cognitive behavioral therapy for insomnia. But some of the main tips there, the main pieces of that, the one that I think is most important is throughout your treatment and especially after surgery, is to set a wake time and keep that consistent, even when you don't feel like getting out of bed right then. So commit to getting up out of bed at the same time every day, even if that means being back in bed napping 90 minutes later. It just kind of creates a tent pole in your sleep cycle that will keep things on track over the long term. So, eating, especially for people who have had digestive problems leading up to their diagnosis, for folks that may have had chemotherapy that resulted in nausea, or for people who have just lost their appetite following a big GI surgery, there can be a lot of fear and stress around eating. So I work with patients to understand what their experiences have been with eating during treatment. We kind of check if there have been any specific aversions that might have developed during that time. Additionally, again, when I'm working with my post-Whipple patients, there's a lot of pressure on them to eat enough to keep their weight on after their surgery. And my goodness, having to eat when you're not hungry is an incredibly stressful experience. And it's one that people around you often don't really understand because everybody else may be trying to eat less than they'd like to be eating. So that can be really stressful. And there can also be stress related to figuring out what to eat after your GI tract may have changed in some ways. And you also want to be eating in a manner that prevents flushing and other issues. And, the dietitians tend to hand out their recommendations, and it feels very, very straightforward in that moment, communicating with a dietitian about what to eat. And when you get home, it's far more complex, and it can be really stressful to figure out how to eat in a different way. So for all these eating issues, I think people don't tend to think of doing, therapy or doing work with a psychologist for them, but it can be very, very helpful. Other things that are helpful are relaxation, distress tolerance, which is feeling kind of increasing a person's ability to feel like they can handle a little bit of discomfort without struggling too much. And then also general treatment for anxiety can be helpful with eating issues. So fatigue, I talked about this a little bit before, and this one's just really hard to push through fatigue. But daytime activity is really important. Giving yourself time to get back to what you consider to be a fully active lifestyle. It can be very frustrating over time to not be able to get there. As much movement as you can do. And for a lot of people, that means figuring out exercise that looks different than it may have before their surgery. And then social engagement. Social engagement gives you a reason to move your body a lot of the time. So that's a very important part of managing fatigue. And, social engagement, it used to look probably like going out to dinner for 2.5 hours with a friend. And that's not realistic necessarily if there's a lot of fatigue. So it could be, setting the expectation for friends and family to show up for 20 minutes and plan to be on their way at that point. And that is a new idea and something that can be hard to lay out to family members, but they usually get it right away. And it's a way to stay in touch with folks, even when there's a lot of fatigue going on. One other thing I would say about fatigue is I see over and over again, people's brains kind of play a little trick on them after they've been fatigued for a month, 2 months. For a lot of people, it kind of sneaks into their consciousness that they are the problem, that they're actually being lazy. It doesn't seem real that they could just be this tired indefinitely. And it's not indefinite. It is going to get better over time, but it is kind of a ridiculously hard thing to hold, being tired for multiple months at a time. So people's brains start to tell them that they are the problem, that they are being lazy, that they're not trying hard enough. And I see this over and over again, and it's a really helpful thing to notice and kind of talk about what's going on psychologically with that belief and kind of work to counter it. So another question that comes up in this long period of fatigue can be, will I ever feel better? And at some points, I know a lot of patients kind of lose the sense of there being a light at the end of the tunnel. And I think one of the most important things for this particular issue is just to normalize it. It is incredibly hard to stay optimistic and positive throughout multiple months of fatigue and discomfort. This also can be a point in time where it might be appropriate to take a more serious look at treating for depression, or at least assessing for it by talking with a mental health provider. Speaking of depression, there can be some specific concerns around neuroendocrine tumors because there can be a relationship to serotonin, and concerns about whether antidepressants are safe for patients with NETs. And, a look at the research that's out there, there's been no evidence so far that there are adverse outcomes related to using antidepressants in patients who have neuroendocrine tumors. So that's just important to know. And especially when there's a fatigue issue, antidepressants are very, very helpful. Without antidepressants, some of our first line treatments for depression are getting more exercise, or getting more social engagement. And when you're really tired, it's just really hard to find the motivation and energy to do those kinds of things. So that makes it even more appropriate to consider antidepressant medication in those situations. So let's talk a little bit about caregiver support. I'm sure there are lots of caregivers listening in today. And everything that I've said about mental health so far in this talk also applies to caregivers. And it's really important for caregivers to seek support, possibly find their own therapist. That can be a really good idea, especially if there's this feeling of being isolated because of how much you need to do to take care of your cancer patient. So it can be really helpful to find your own therapist. You can also, even without talking with a therapist, work with other people in your life to figure out how to draw lines around what you can and can't do. I think there can be a pressure on caregivers to do everything they possibly can to be totally selfless, because they are not the one who is dealing with cancer in their body. They are not the sick one. And that's actually kind of a dangerous way to think about it. So I think within the dyad of the cancer patient and the caregiver, you can kind of lose perspective at some point about what an appropriate line would be to draw in terms of protecting your own time, your own happiness. And so it can be really helpful to bring other people, family members or friends, into that conversation to help you kind of recontextualize what your role is with a caregiver and where you might be running into burnout. Also, really important to know when to ask for help. Both the patient needs to be able to do that, as well as the caregiver. That is one of those things that can get thrown out there. Be sure to ask for help if you need it, so simply. And it's actually a very, very difficult thing for a lot of people. Asking for help is just a drastic change in their own sense of who they are. They might be not the one who asks for help, but the one who gives help, who is selfless. And so to switch into a role where they suddenly need to be asking and accepting of help from others can be a huge identity switch and very challenging psychologically. So after treatment, in my practice, I often meet with patients for the very first time after they've completed their treatment, which doesn't seem like the time when you would be thinking to reach out to a therapist for the first time. But this can be a very stressful moment. You're maybe no longer taking action to fight cancer directly. There's no nuts at this point. You still have squirrel brain racing. There can be a sudden disconnection from the social element of treatment. Those infusion nurses are wonderful people to spend time with, and losing that connection can be very difficult. People develop a sense of hypervigilance about their bodies after treatment. They're constantly scanning their bodies for, any signal that there might be an issue. They start to have to really cope with fear of recurrence as a primary focus. And in addition to the fear of recurrence, there's the fear about never being able to stop worrying about recurrence. So that would be a fear of a fear, but it's very real. Will I be worried about this for the rest of my life? And how will I deal with that? So a lot of issues can come up for the first time after treatment is complete. So it's very common for survivors to worry about cancer coming back. This fear of recurrence is real and normal. It can often feel intrusive, like fear of recurrence keeps showing up in your brain, even when you don't want it there, when you want to be thinking about something else. And those survivors can't control necessarily whether their cancer comes back. They can control how much the fear of recurrence impacts their life. And I think it's really helpful to work with a therapist at times to kind of make a decision around not wanting it to interfere with your life. So, when we think about managing fear of recurrence, here's just some strategies that tend to help. Noticing your emotions, being able to notice that you're feeling scared. This is mindfulness. We hear a lot about mindfulness. Mindfulness is being aware of how you feel about a certain topic in the moment without being judgmental of it. It's also important not to ignore fears. Telling yourself not to worry doesn't make fears go away. It's appropriate to have some anxiety. We can't kick anxiety about cancer coming back. We can't kick it to the curb. It wouldn't make sense to do so. It is more a process of learning how to live with it. And it's also important not to worry about this alone. Finding support groups online and in person can help normalize fears and help put them to rest. One thing that's really important to know about fear of recurrence is, coping with it is a process. And it makes sense that the year after cancer treatment, it's going to be front and center. I like to talk about it as a book that you're now stuck with. Those books you've had since you were a kid or since college, maybe, that you keep moving, you can't get rid of. It's like one of those. You're stuck with it now. But you want to be able to, over time, figure out where you want it to live in your house. Is it on a bookcase in the living room? Is it in a box in the basement? Hopefully it's not stuck on the coffee table for the rest of your life. It's not the thing you think about all the time. So, again, thinking about the idea of mindfulness, one way to think about this is to think about it as the difference between being in a storm versus watching a storm. So when we are in our emotions, in our fears, we can feel really chaotic and really like they are in control, kind of like how it would feel to be in a tornado. If we're able to step away and witness our fears, see them, then it feels more like watching a tornado or watching the rain. That is a much more in control experience. So, one of the number one things, and this is so simple and so challenging, is to just notice what you're feeling. There it is. There's squirrel brain. There's my fear of recurrence that makes sense and is also not helping me. So, that kind of awareness of what you're feeling, when you're feeling it, without judgment, is very, very helpful in moving forward after cancer. Another strategy is just reducing stress, spending time with friends and family, focusing on hobbies, exercise, getting back to loving the things you love, like reading things that are funny or watching favorite movies. And then additionally, be well informed. No one can tell you exactly what will happen, but most of these cancers do have a predictable pattern of recurrence. You want to get an accurate explanation about your chance of recurrence and know what symptoms to look for. And knowing what to expect can really help you stop worrying that every ache and pain means the cancer has returned. I think, for everybody who is a cancer survivor, there's going to be a lot of moments of, is this aging or is this cancer coming back? It's valid to want some extra support from your physicians, be it primary care or an oncologist, to help navigate that, because you've been through a lot. And discerning what a basic ache or pain means can be more complicated if you have a cancer history. So be sure to talk with your providers about the plan for follow-up care, and not just what the plan is, but why the plan is the way it is. And having a regular schedule of follow-up visits, can provide people with a sense of control. However, I'll say also, there's nothing like scan anxiety. It's so scary to be coming up on a scan. It feels like that scan itself is dangerous because it contains within it the possibility of negative information. I think the goal with scans, and this is a process, it takes a couple years, but the goal with scans is to get to a point where it feels like you're dropping off your dry cleaning and you're going to need to pick it up in a couple days. That is our ideal approach to scans over time, that it feels more normal and like not a big deal, more of an annoyance, but it's hard to get there. And it just takes a couple of years to get to a point where you feel a little safer in those moments. And then also, making good health choices about diet, exercise, smoking, drinking alcohol also helps people to feel in control, which helps to manage fear of recurrence. However, there's a lot of fear mongering out there that, for example, sugar feeds cancer. And oh gosh, that makes me mad as a cancer psychologist, because it is so unhelpful to have those broad generalizations out there that are not useful, do not speak to the cause of your particular cancer, and are really just generally unhelpful. So yes, keep an eye on these things. Yes, take good care of your health in a way that feels good to you. But also, you got to figure out a line where you're not obsessing about it or making yourself feel like a failure when you don't hit unrealistic expectations. Another piece of managing fear of recurrence is build in new activities into your life that bring you joy. You might be really interested in different things. And I put this picture up here. This is a picture of me and my vintage water ballet team from Richmond, Virginia. I was really struggling to finish my dissertation while I was working on my PhD, and really stressed, really frustrated. And then I started doing water ballet with my friends one summer, and everything got better and my dissertation got wrapped up. So sometimes it's not about dealing with what's going on with you. It's about adding some new source of joy. So when you can't figure out how to feel better, add in something that you love. Post-traumatic growth. So post-traumatic growth are the positive life changes that develop through a stressful or frightening experience. The words are similar to post-traumatic stress disorder, but it's the opposite essentially. And I think it's really important to mention this and to really highlight it as a beautiful thing. Types of personal growth. You could have improved relationships with other people, new life experiences that you're interested in, maybe a greater appreciation for life, a sense of personal strength possibly, and even spiritual development. And, a lot of people will describe to me that they are crying all the time, or they cry really easily. And it might not even be something that in of itself is uncomfortable. Like it's not crying out of sadness or despair. It's just having bigger emotions in relation to other people or other stimulus, the typical crying at a phone commercial, perhaps. And that can be very uncomfortable when it starts, but it's not necessarily a bad thing. Some people will describe it as like they've found a new emotional gear that they didn't have before, and it takes a little while to get comfortable with it. And some of the factors contributing to post-traumatic growth, people most likely to experience growth are those who generally adapt well to new experiences, who are able to keep a cheerful outlook, and those who have strong social support to help them have a cheerful outlook and help them see the good in things in a meaningful way. Other, ways to encourage personal growth: reduce the anxiety in your life if you can, reflect on your experiences. That could be through journaling, that could be through talking with friends, whatever works for you. Restore a sense of safety in your life, get back to things that feel normal and safe for you, connect with other people, and kind of create a post-trauma life vision. What do you want your life to look like now that you have kind of stood on the precipice of real, life-threatening illness? How does that change you? I always like thinking about this kind of like when Spider-Man, you all know the Spider-Man origin story, gets bit by a spider and gets his new powers. I like thinking about that because in all Spider-Man movies, after he gets his powers, there's always a scene of him swinging around New York, slamming into walls, right? It's not easy right away. And that's the same with post-traumatic growth. You have a new depth of emotion that can feel really uncomfortable, that you don't know how to use at certain points. It can be weird in relationships even, but over time, it's a really beautiful and wonderful thing, and maybe even a superpower. So what is the long-term goal of psycho-oncology and of thinking about our mental health and well-being after cancer? I believe it is to live well, have meaningful experiences and relationships despite the challenges and changes in your health. So this is being aware of and accepting of the things that may have gotten harder in your life. For example, maybe you have to worry about diabetes now. Could be any number of different things that have changed. So to get to a point where you're able to accept those differences and still have meaningful, wonderful experiences and relationships. So this is my son, Gus. He's a real cutie, and he has an epic cowlick on his head, as you can see here. And this is a very powerful cowlick. This is a picture of him immediately after getting his hair cut. There's no stylist in the world that can manage this thing, and it's always notable. And Gus would be in a real bad spot if his mom was obsessively trying to comb that down, as grandma sometimes suggests I should. But we're not going to do that. We can accept that he has a cowlick on his head and he needs from his life to go out and throw rocks in the lake. That's what he needs to have a meaningful day. And it's very important that we not let that cowlick on his head interfere. So this is my kind of closing metaphor for how you might think about your experiences with cancer, as they are certainly something difficult that could derail you and will derail you at times in your life. And it's really, really important to figure out your way back to throwing rocks in the lake, to doing the things that are meaningful for you, and to living your life fully.
Wow, thank you, Dr. Kirstein, for that really fantastic presentation. There's so much I love about it, but before we get into the Q&A and unpack some of it, I just wanted to remind the audience that this question and answer session is for educational purposes only. It does not substitute for medical advice. Please talk to your medical team about your questions or concerns about your individual care or treatment. Dr. Kirstein, thank you again. What I really loved about your presentation is that it almost feels like you're a mind reading. You like read my mind. You know what's going on, and you give language to these things that are really hard to explain and to capture. So thank you so much for doing that.
Oh, well, it means so much to me that it is helpful to people, and thank you so much for having me.
Yeah, absolutely. I mean, this is personal to me too, as you know. So, coping is part of my journey as a caregiver. I know Heather as well as a caregiver, and it is something unique and experienced by each person in different ways. So I appreciate all the different metaphors and the range of experiences that you kind of touch on.
Thank you.
So thank you for that. Okay. Well, if we can jump into some of the questions, and some of it you may have already covered, but let's just kind of touch on it maybe in different ways or however you might want to add on to it. So the most upvoted question was part of what you talked about at the end is this whole thing of anxiety. There's different buckets of anxiety, but in that one of the main categories is scanxiety, which I recently read an article that approximately a third of patients experience scanxiety.
Yeah.
So I know you touched on this and you talked about quite a bit, but what are some practical suggestions of how to manage scanxiety?
Yeah, I think, one place to start is just to notice that scanxiety is not about the scan itself. And it's not even about the results so much. It's fear of your own reaction to the results, fear of the emotional experience you would have if the results came back with bad news. So, your risk of of recurrence or of cancer coming back, it is consistent across time. It's not like it spikes at the scan, but our potential for knowing about it is what increases at scan time. And so we're really fearing our own fears, our own reaction to the potential bad news. One of the things to do is just to notice that, because if you become aware that that's what you're doing, that you're fearing your own emotional reaction, some people can then sort of reassure themselves that they've gotten through it once before and they would survive the experience of another diagnosis. And that doesn't make it easy by any means, but noticing that what the fear really is can be helpful.
Yeah, thank you. Someone else added that feeling of waiting for the next shoe to drop. So I'm just going to read their question. How do you deal with having NETs but having never had a symptom or any treatment other than maybe a lanreotide shot, somatostatin analog shot for 3.5 years? People are shocked, and I always wonder when the next shoe will drop, and I have scanxiety wondering.
The most important thing there is the passage of time. Honestly, it's a process of kind of getting so that you once again trust that that scan is not going to come back with bad news. It's kind of like you went camping and you got bit by a bear. So last time you had a scan, you got incredibly bad news that came back. And so it's going to feel like that every time you're headed into a new scan until you start having the experience a few times of not being bit by a bear. Get back into camping without having to anticipate that negative experience. So definitely the passage of time can be helpful. Additionally, this is a great time to use distraction. Plan, save up your favorite episodes of TV to watch. Plan a trip with family. Keep busy. That's another great way to get through it.
Yeah, distractions, pick up a new hobby, a new activity, as you mentioned,
Yeah.
something that can bring some joy.
Yeah.
Another person actually shared something that has some overlap. I'm constantly thinking about it spreading, mostly because I read about how doctors can barely see it, even with CT scans, etc. How do others do it? Ones that have had it for many years. I'm 18 months in.
So first off, that fear of it spreading, it makes sense because we think about it's very visual, right? You have this idea of a cell that got away and is floating through your body and is getting ready to land somewhere. So it's this incredibly scary thing, and it's also very, very visual and kind of evocative in a way. So one of the things I remind people of is our immune systems are always working to beat up those individual errant cells. So you are changing that kind of visual image into one where you have some fighters on your side. Your immune system is working for you all the time. Kind of changing that image in your mind can be very, very helpful. And then the other thing with, worry about it spreading, a lot of people develop what we call hypervigilance, where they're always scanning their bodies from inside to see if they feel anything new or alarming, like they'd be able to pick up if there was a recurrence or spread of the cancer. And this develops into a habit that's really stressful, really hard to work on, but it also makes perfect sense. You've got part of you that's trying to catch anything that would happen, catch it ahead of time. So, this is not crazy to be constantly worried about this and scanning your body, but it's also not helpful. So you can get good at noticing when you're doing it, and choosing a different behavior is kind of the basics of how you'd want to approach that. And this is something that a therapist could really be very, very helpful with, figuring out for a plan for you individually to manage that fear of spread.
Yeah, and that's a big one. This person asked, will you discuss suggestions on how to address emotional, mental, and psychological challenges dealing with being cancer-free, but having to test for at least 10 years before you're out of the woods? That's a
Yeah,
big
so
question.
that's your scanxiety, right? That's
Yeah.
that's it right there. And like I said before, I think over time it gets a lot easier, and for a lot of people, quicker than they think. And distraction, being aware of what you're actually afraid of, being confident that you have good providers who have taken great care of you. All of these things can kind of contribute to starting to feel a little more confidence over time.
Yeah, time, for sure. Similarly, can you discuss methods for managing anxiety related to watching weight? As an aggressive lymphoma survivor who underwent chemotherapy immediately, anxiety from the watch and wait approach for my 2 neuroendocrine tumors 17 years later is awful.
So this is going to sound overly simplistic, but I think at some point there's a decision to make. Even you kind of have to make a decision that you're not going to let worry about the cancer coming back bother you, cause distress in your life, cause your life to be less happy, less good. And That decision, though, is not an easy task. Like, it feels kind of dangerous to not worry about it. And, that is a kind of pessimism that actually feels protective in our brains. It's almost like a little superstition. Like, we feel like if we don't worry about it coming back, it is more likely to come back. But that's not actually true. Our worry about it, our perseveration about it doesn't actually change the likelihood of the cancer coming back, but it feels like it does somehow, like we're doing some kind of work to keep it away. So working to notice that and recognizing that the worry is logical, but not helpful, can kind of leave you feeling more empowered to try to shift it.
Yeah, really honing in on what is exactly the worry and defining it. Yeah, I know that, again, there's this other person is talking also about travel and how it adds to it. So the 24/7 of this condition is dreadful, burnout, always on my mind, worry and stress regarding travel because of short bowel syndrome also adds the high anxiety. So I take Creon, meditate, and it helps, but not 100%.
So travel is so important to living a full life for many people. And I think prioritizing it makes sense. Let's think about it this way. If somebody had lost a limb, but they were too stubborn to use a wheelchair, and so that means they weren't going to travel because they wouldn't be able to get through the airport, we would, push back on that really hard. And it's more complicated with some of the bowel symptoms, certainly, but there are things you can do to prepare and to be ready if an accident should occur. And I think that those are similar in some ways to kind of having to use a wheelchair, possibly. Those kinds of preparations, preparing to tolerate embarrassment if it should happen, just, kind of preparing yourself for that. Those are the wheelchair in this case, the important tool that you need to use to be able to live your life fully. And I think if you think about it like that, it becomes a little bit easier to wrap your head around.
Mm-hmm. So finding ways to prepare.
Yeah.
And this person also is looking for ways to prepare. How do you put worries about illness, care, and uncertainty out of your mind? I'm healthy now, but my spouse isn't. So I worry about our future care and where my nets will go next.
Yeah. So again, with this, the worry here is not irrational. This is not crazy. Your worry is logical. It makes sense. The magnitude, like the intensity of the worry or the frequency of the worry, is what we're more concerned about. And some of the things I talked about in the talk today, like mindfulness, naming your emotions when they show up, making a choice to shift gears when you can, all of those are kind of in the mix for decreasing the frequency of the worry. Here's another way to think about it. If you imagine a field of tall grass that has one path mowed down through it, that path can often become worst case scenario. That thought path is you thinking over and over again that it's going to get worse, the health problems will continue or get worse. And if you think about, again, this field of tall grass, it's very difficult to go trample a new path. And we don't do it because it's just intuitive to follow the path that is well tread. So a way to think about shifting your frequency of thoughts is you're going to have to tread some new paths of thoughts. And so that means noticing when you're having a negative or catastrophic thought and choosing to also entertain the positive alternative. Not that it's necessarily true or that the negative one is necessarily true, just to give it some time to live in your brain helps to tread a new path that makes it easier to have options instead of always going to the negative worry.
Yeah. So the next couple questions have to do with cancer and the word of cancer. How do you help a patient who has to cope with the diagnosis when many in the medical community labels it as not cancer? That word carcinoid, right? Meaning cancer-like and not necessarily cancer.
So kind of just in the nature of this question, I'm noting it's really, for this person and for many, it's really important that it be named cancer. And there's clearly a lot of value, in a sense, attached to that. So I think examining that is probably important. If by saying cancer, you feel like you will gain more support from the people around you, maybe that's what you're actually after, is that additional support. And there might be more direct ways to ask for it, to say, I need more support here. I am scared and I need you to be with me and help me be distracted on days when I might go have a scan. So I guess that is sort of really thinking about why that word is important to you and making some strategic choices about how you could get what you need, even if the word isn't accurately attached to it. So that, what I'm saying there, though, I fear it might minimize part of the question because it's also frustrating when that's not labeled appropriately. And so I think figuring out and then practicing some language that you like to use that's comfortable for you for explaining this would be a really good choice. And I actually mean practice it. Get it so it slips right off the tongue and you feel very comfortable advocating for yourself in that way.
Yeah. Wow. So reflection and practice with language.
Mm-hmm.
On the flip side, this person's a recently diagnosed neuroendocrine tumor patient at the age of 32 with 2 kids, 3.5 years old and 1.5 years old. How do I stop worrying about the time I've potentially gotten capped in my life and just the fear of the C word?
Yeah, again, we're naming a lot of really, really scary things there. And when you think about the possibility of your life ending early, what that is anticipatory grief, feeling the loss ahead of the loss. You can't help but worry about it, but to kind of experience the sadness of something that might not happen or hasn't happened yet is not really helpful. So this is another spot where it's good to kind of make a choice that lines up with your values and trying to shift your thoughts, again, kind of with my example about the tall grass, shift your thoughts over time to not be so repetitive in that negative direction. Again, this is something that a therapist can be very helpful with. But yeah, lining up your values about the time you have with your children and figuring out how you want to live can help you feel that no matter when the end should come, you have lived it the way you wanted to. And that can offer a lot of solace.
Wow, thank you for that. We're going to shift a little bit into communication. There were several questions along those lines. I wrapped a couple of questions together here, just under the umbrella of, can you share some suggestions or practical advice of communication strategies with family and friends? Number one, how to even explain the cancer. We talked about the C word. Some people use it, some people don't. And how to deal with family members that downplay or don't understand the type of cancer. It's not curable, it's chronic, it's different from other cancers. There's so many different parts to this.
Right. So one, kind of like I said before, I think it can be very helpful to practice some language. Examples of language that I've come up with patients are, they might have heard through the grapevine, oh, I heard this person has pancreatic cancer. And you end up talking to them and you want to say, wait. Actually, what I have is a shockingly treatable and manageable version of this. So when you're talking with people, is to acknowledge the confusion that exists around neuroendocrine tumors and then name what they actually are, that they are very treatable. It's still very scary and there's a lot of unknowns, but you're told your prognosis is good as long as you keep up with care indefinitely over time. So I think that's one way to go. And again, I think some of the trick in there for some of the social awkwardness is to literally practice what you want to say and kind of role play it with someone so it gets comfortable. Otherwise, it can be really intimidating to go to church, for example, where people may have heard what's going on with you and you have to explain it over and over again. But we don't want you to not go to church because church is going to help you potentially stay connected to other people. And so that's really important. And having a way that you will feel confident talking about your cancer is really important. And then the question about family members that downplay or don't understand the type of cancer, that can be really frustrating. And the way I see this come up frequently is actually that everyone around you is very upset and very supportive, checking in at the beginning of the cancer diagnosis, because their historical experiences of cancer might be it is, treated with a surgery and then you're done, or it is something that, is something you pass from quickly. So again, educating people about it is one thing, but communicating the long haul of it, that this is going to be going on for a while, is really, really difficult. I think we should at the Cancer Center pass around buttons that say "not done" on them, because that message is very much missed by family members. And I do have empathy for that. Like, it is hard to maintain a sense of alarm for someone over a long period of time. We are all more focused on our own lives, and so we get distracted, and it's difficult. So again, I think I, kind of suggested this before, but it is on you, sadly. It shouldn't be your responsibility, but it is, to say, I'm not done. I still need support. I'm still scared, to speak those words and be assertive about them. And it stinks that that burden ends up on the person who is struggling. Others should be more aware of that. But, repeating that you still have needs can be really important. Additionally, choosing a person to whisper it to the network that you're not okay, that you need support, can also be a strategy to get the message out there.
Yeah, I think that that's really helpful. That is the crux, right? How do you explain to people that's not like other cancers where it's just done and it's chronic, what we were just talking about with anxiety, it's chronic,
Yeah.
that my life has all of the scans, the anxiety, medications, injections, treatments, and it's just on and on for many, many years.
Yeah, not done.
Not done. And along those lines, someone asked, should I tell my friends about neuroendocrine cancer, considering it's a good-looking cancer, and deal with the remarks like, but you look fine. You look so good, right? We get those.
Yeah. I've never had cancer, so this is one where I might not understand it. But I think you should tell the people around you. I don't see much benefit in people not knowing who are likely to care about it. But I hear this often, that you don't want other people to know about it. And I think that really has to do with some social anxiety about interacting with other people about what's going on with you. And so it might take, addressing a little bit with a therapist, some of that social anxiety about communicating about it. And then when, it comes to those cutting remarks, again, I think there's a burden placed on the patient to be assertive and to call those out and say, that is not helpful. That is completely unhelpful. And I want you to know that, and please don't say it again. And there's a way to deliver that, I think, with some warmth and sort of lightness that you could cultivate over time. But these are really insulting moments. This goes in the book. But you look fine is going on the what not to say to cancer patients book.
But you look fine, but you look so good.
Yeah.
Those are tough, right? What about people with limited support? I have a very limited support system. Spouse not retired, provides inconsistent support. I travel for net specialty care, concerned about future travel to net specialists in the hospital, and who would care for me as I become more advanced, or my disease becomes more advanced?
To be honest, this is a tough one to answer, and it's in my practice, it's a point where I feel like my hands are very much tied. When a patient doesn't have much support, it's hard to do a lot of the things that are likely to improve your well-being emotionally when you don't have support. So I think, thinking outside the box, neighbors are often people that maybe don't know that they care. So, one thing to do is to sort of open up, the topic among people that you might not have spoken with about it before, to increase the scope of folks who know that you may be struggling. But it's really hard when you don't have social support, and our culture isn't exactly set up to care for folks who are going through health scares, and health difficulties. So, I think the personal is political. Our culture, our systems of healthcare are not necessarily designed to offer the support that we should, and it is very hard to generate it when it doesn't naturally exist.
Yeah, so difficult, especially here. On the other side of it, many people have families that they're taking care of. Can you share some suggestions of how to talk about this cancer with my kids?
Yeah. So, it's going to vary a lot based on, their ages and what they can take in. First thing to know is most big hospitals have child life specialists that you can meet with. It's something that's often covered by insurance. And you may only need to meet with them once to get some specific coaching on how to talk with your kids about it. So that's a really good choice. And then, in terms of talking with your kids about cancer, first off, do talk with them about cancer. It is not a good idea to withhold information from any kid, I would say, over the age of 3, honestly. And here's why. Kids are smart and they're sensitive, and they're going to know that something is up with their adults. And it is not really good for their mental health or their development to feel like something is wrong, but they're not allowed to know about it. And so that creates kind of an uncomfortable experience inside the child. And you're better off telling them what's going on and even naming that you are scared about it, but then also modeling that you are managing your fear and taking care of yourself and doing everything you can to support your health. So, in whatever age appropriate way you can kind of convey that, that's what you want to talk about is your real emotions, your real diagnosis, just in as minimal terms as possible. And, I think a lot of parents fear that they will be causing increased emotional distress in their kids if they talk about it and if they talk about how they're scared or how they're experiencing it. And that's not true. Kids can handle their adults having emotions. In fact, it's really healthy for them to see that. And for what you need to be able to do is name that emotion and talk about how you're coping with it. And then it's actually an incredibly positive developmental experience for those kiddos to witness their parents being able to cope with something difficult. So, with that in mind, I think you can kind of design an approach that is genuine, honest about both the cancer diagnosis and the potential fear, but that also supports the child.
Yeah, wow. What a thoughtful answer and well-rounded. I mean, really, not just talking about what it is or what the cancer is, but how mom or dad feels about it and the fear.
Yeah.
hmm And child life specialists is what you said
Yeah.
are available. Okay. There is a clarifying question. I'm going to go back to this in the relationship to the anxiety comment. You said several times that scanxiety will lessen as time goes on. In the case of NETs, as time goes on with treatment, it becomes more and more likely there's some kind of progression, not less. So I just wanted to circle back to that, so to let you
Yeah.
address that.
Thank you for that clarification. And, I think if you conceptualize that the scan itself is not dangerous, that the scan itself is not the thing to be afraid of, that can help you get your mind around managing the fear specific to the scan. Now, that doesn't necessarily address the fear in general of cancer recurring. And that, again, it's one of these rational fears. It makes sense to worry about this, but you want to think about the magnitude of worry and the frequency of worry and make a choice that it doesn't derail you having meaningful experiences and good relationships and doesn't derail your life. So, we talked about some of the strategies for kind of managing worry, but, making that choice, maybe working with a therapist in that situation, all of that is helpful.
Yeah, thank you. Thanks for clarifying. Um, what are some practical things that we can do now while we're healthy that prepare our families in the event of our passing that might help with their coping and ease that transition?
Okay. I kind of think it depends a lot on individual factors, but I've mentioned values before, and I think identifying your values and talking with loved ones about them, and then choosing to spend as much time with them as possible, living out those values, whether that is family, community, art, that leaves you in a position of having had deep connection with family members. I think it's also, okay to talk about death and loss. We tend not to, but naming it and naming the fears around death and loss can really normalize that possible experience. Your question is specifically about coping, and sometimes you also want to switch your thinking on that a little bit, because losing you will be incredibly hard for this person, and that's okay. That's okay. It means that you loved each other, and they are likely to be able to rebuild a life. So, maybe part of this question is actually allowing it to be okay for your loved one to struggle at some point, knowing that they have the ability to cope with that and to move on.
Yeah, we can't necessarily fix it all as much as we would like to, and ease that suffering. There are a couple questions about mood. What are some best approaches to keeping a positive, supportive attitude as you cope with the mood swings and various physiological challenges facing a loved ones with carcinoid cancer?
Mood swings, you're talking about irritability often, crankiness, depression, low motivation. And, I think, as I was talking about before, where it's really useful to name emotions, if you can, with your loved one, figure out ways to talk about the moods that they're in that are not full of conflict, that are not conflictual, figuring out a language where you can say, oh, I see, your cranky part is really here today. What can I do to help that feel a little bit better? To be able to name it with that sort of separation, that you are not angry with the person, that you love the person, that you see that they are struggling, and you see that they are having an emotion that is part of their health problem. So I think being generous enough to see it that way and to speak about it that way, like, this is your cranky part, this is your sad part, and that can be a very helpful way to navigate it.
Yeah, wow. Naming it. I like that separation, so that it's not taken so personally too.
Yeah.
Yeah. What about for moods that fluctuate during the day? Do you have any advice for counteracting a recurrent pattern of often having a low mood for the first half of the day, which gradually lightens until late afternoon when mood and energy levels are much better?
Okay. So I'm going to assume in this question that things like sleep and nutrition are in place and are being well managed, but certainly I'd want to make sure that that your nutrition was in a place that was supporting energy and alertness in the morning, because any fatigue that you might be having is definitely going to exacerbate any negative mood. So it might be also maybe some movement in the morning might also help with that mood. But beyond that, again, I think this is one where I would say naming it. Okay, here is my dark morning visitor, or whatever you want to call it, and trying to separate yourself from that emotional experience in as much as you can, knowing that it will lift. Maybe even visualizing that there is a dark cloud sitting on you for a couple hours in the morning, and we need to wait for the weather to clear before I can go do the things I want to do and be with people. So that might be a way to think about it. I guess that fits in the category of kind of make friends with the pattern, kind of figure out how to cope with that, how to live around it. Maybe you need to be alone in the mornings. Maybe sunlight makes a difference. Caffeine can make a difference. So I would say experiment with all those things, and then, some real self-acceptance that the weather can be dark at times and the sun will come back.
That's helpful. Yeah, the naming and visualizing.
Yeah.
Going back to communication, how would you deal with rural physicians who are dismissive with neuroendocrine tumors due to a lack of understanding?
Wow. So I don't have a lot of experience with this, but again, I think this is one of those places where you have to cultivate some assertive communication skills. And so that's really hard. And again, I hate that the burden of doing that lands on the patient, who should not be in the position of having to do that. But I think, being assertive, knowing what you want to say to folks and what will and will not be accepted is a start. If there is a specialist that you see elsewhere, you might try to facilitate communication between that person and your home physician. I'm imagining that's the scenario there. And beyond that, again, letting the rural physician maybe know how it feels to you to be minimized in clear language. That is a perfectly reasonable thing to do, and it doesn't make you a bad patient. Neither does assertiveness, which I know is a fear a lot of the time, especially maybe in a situation like this. So, figuring out how to feel confident being assertive with information is probably going to be the crux of it. And again, that's something a therapist could help with pretty quickly, actually.
Yeah, wow. It's too bad that living with neuroendocrine cancer forces us to really hone our communication skills.
Yeah,
Yeah,
not fair.
not fair. Um, this question is really interesting. How do I balance self compassion, taking a break when I feel I needed it, and doing the right thing like daily moderate exercise when I'm mentally and sometimes physically drained? I think this is an excellent question.
This is a great question. And it's a really hard one. When we talk about motivation is so tricky because it is the thing that gets you to exercise, but then exercise is kind of the thing that gets you to motivation, and gets your mood into a place where you feel comfortable doing that. So, starting small is really important, and really small, like something and by that I mean something that is not painful for you, that is not, cause discomfort. And perhaps that is, chair yoga, or something you might not have thought of yet, that is genuinely feels safe and approachable. So that can be a strategy. But you're asking about the balance between self-compassion and doing the right thing. One other thing to look into, and you could just Google this, but spoons theory is a strategy for managing, kind of energy conservation and being able to prioritize how you use your energy. And there's a lot of great literature and support groups out there about spoons theory. They kind of quantify units of energy in spoons, is how they talk about it. And that can be a really helpful way to come up with strategies to do exactly what you're talking about.
Yeah, yeah, I love that. I recently came across that. And also, it just kind of addresses how there might be some seasons where the right thing, the healthy things, right? The exercise looks
Yeah,
different or whatever those healthy habits are.
yeah,
Yeah.
yeah.
We're going to end with this last question. You've talked a lot about how therapists can help, and there were a couple people who asked, like, could you refer me to someone in this city or that? So, in general, how do I find a therapist or counselor who understands what I'm going through? And do I need to find
Yeah.
someone who understands neuroendocrine cancer?
So I would say no, you do not need to find a neuroendocrine cancer specialist. You could search online a cancer psychologist. Psycho-oncology is what it's called in some settings. Or you could search just for a health psychologist. And these are people who are trained to work with people who are struggling with health issues. And they're also going to have enough medical background, ability to read journal articles, et cetera, that they would be able to learn about your health issue and be curious and be able to take up information so that they could work with you on navigating some of the unique challenges. So, you can go to there's databases out there where you can search by key terms for therapists, and health psychology and cancer would both be good things to search there. And then the other thing I always say about finding a therapist is, the outcomes show that the most important thing when finding a therapist is having a good connection with them, feeling comfortable with them. So it is so hard. I sometimes say it's kind of like buying shoes online. You can dial up exactly what you want, but you won't know if it fits until you try them on, right? So give yourself permission to try a therapist or two. And if it doesn't feel right, try another one. Again, that's a burden that should not be on you. That's not right. But if you're not comfortable, the therapy won't be particularly effective.
I think part of it too is the how to go about it, because people are often like in the world of surgeons and such,
Yeah.
we're looking at referrals. So do we need a referral? Do we need to find like someone we trust, a physician who would refer us to a health psychologist or psycho-oncologist?
Yeah, it depends on your cancer center's policies. Where I work, my patients do need a referral. The whole range of different types of providers. In my setting, at least, I get referrals from any of those folks. And pretty much the moment a patient raises, a mental health concern, they're going to get a referral where I work. But you also wouldn't necessarily need a referral to find someone in the community. I will say that most, mental health providers within cancer centers, you can't just go see them if you're not having your cancer treated at that cancer center. So there is a limit there. But there are people in the community with this kind of background and who advertise it as such.
Yeah. So the key words: health psychologist or
Yeah.
psycho-oncologist.
Yes.
Yeah.
Health psychologist or psycho-oncologist, or just cancer too.
Yeah, cancer.
Chronic illness might also be another search term.
Especially with neuroendocrine.
Yeah.
Well, thank you so much for this amazing, both the presentation and this discussion. We really appreciate you, all that you do, your care, your compassion, the research you're doing, and the collaborative work you do with the multidisciplinary team as well. Really appreciate just you naming it, demystifying it, giving it language, giving us some tips and some encouragement through this really challenging time.
Well, it's a pleasure to be able to share this more broadly, and I really love the work that I do. It's a real privilege to do it. And thank you for having me.
Thank you so much. Now I'm going to turn it back to Heather in the studio.
Thank you again, Dr. Kirsting, for your insightful and considerate presentation and for addressing the important topic of coping with an uncommon cancer. We appreciate our supporters, Novartis, Ipsen, Exelixis, Tercera Therapeutics, Curium, Crinetics, ITM, Boehringer Ingelheim, and Inner Science Institute. Educational programs like today's are also made possible by donors like you. Please consider making a donation today at ncf.net/donate. And a special thank you to our technical director, Rich Tamayo from TVP Live, for this high-quality broadcast production. Again, today's presentation and Q&A session have been recorded and can be viewed on our website and YouTube channel shortly after this broadcast. If you register for today's webinar, you may receive a survey via email. We would greatly appreciate you completing the survey as it helps us improve our content and with our fundraising efforts. To receive our reminders and newsletter, be sure to add events@ncf.net to your Safe Center contacts and whitelist email list. Again, that's events@ncf.net. Again, follow us on social media to stay up to date on our upcoming educational events and in-person conferences. Our handle is @NCF And now I'll turn it back over to Lisa.
Thank you, Heather. The Neuroendocrine Cancer Foundation is a community of support and resources. We recognize that you are more than your disease, and we aim to support you as a whole person. To this end, we offer many resources and programs. Find out more on our website, ncf.net. We offer a monthly podcast featuring experts who answer the top 10 questions in their field. Go to our podcast page to check out the episode transcript, resources, and the 10 questions we asked the expert. Thank you for joining us today. Goodbye, and we look forward to seeing you in Miami next month.